This is going to be a real quick video on how to use a nebulizer for cats. And I am using as my nebulizer chamber a incubator. And you don't need to use anything this fancy. You can use a carrier and wrap towels around it, or a plastic bag, something like that. You can use a storage container and cut a hole in it so that your nebulizer will then fit through the hole. If you use a carrier and wrap it with plastic or towels, you're going to have to hold the nebulizer in position so that you get all the mist into your nebulizing chamber. But anyway, this incubator has a special little door attachment for nebulizing, and that's what I am using. And then the regular door just kind of slides into position and makes it airtight for me. So that is that. This is the actual nebulizer. That's this little doodad here. And it fits onto my little spigot thing. The medication goes in this bottom half, and we'll get into that in just a minute. So we have here the nebulizer, and we have our airline tubing, and it goes up to the compressor. Got my medication. In this instance, I'm using gentamicin, and this is 100 milligrams per milliliter. Comes in different strengths. You will need a total of 250 milligrams of medication to nebulize a cat. So you'll have to do the math on that. You're going to need your medication, you're going to need sterile water, or if you order the individual packets of water from a nebulizing website, these are really great. I like these. These are little 3 milliliter sizes, and you're going to need a syringe with the needle on it to get your medication out of the bottle if you're using a bottle like this. You can use tablets of other medications, whatever. There's lots of ways to do this. This is just one. So to begin with, what you need to do is attach your airline tubing to your compressor. Make sure it's on there really, really tight. And you need to attach the other end of the tubing onto the nebulizer. You do that first because if you don't, your medication is going to leak out the bottom. You'll see the nebulizer has this little cone on the inside that does come out, but leave it in there for now. And what you need to do is, if you're using the gentamicin, remember you need 250 milligrams, and this is 100 milligram per milliliter. So I'm going to syringe up 2.5 milliliters, or cc's, it's the same measurement, of gentamicin into my syringe, and I'm going to put that into the bottom of my nebulizer. And then I'm going to add some sterile water or the sterile saline solution, whichever you're using. You want a total of 6 to 8 cc's of liquid in the bottom of the nebulizer. So if I've added 2.5 cc's of gentamicin, I'm going to need about 4 to 5 cc's of water in the bottom of the nebulizer. You just want it full. You want to get a full 20 to 30 minutes of nebulizing time for your cat. So you may have to adjust the amount of water you add as you figure it out the first couple times. So you have all of your medication and your water in the bottom of your nebulizer with the little cone inside. And you're going to screw that on to the rest of the unit. Make sure it's snugly attached to your nebulizing chamber. And then you turn on your compressor. What you will notice is that all the liquid down in the bottom of your nebulizer will start to kind of fizz and bubble a little bit and make a real fizzing sound. And you will notice if you look inside the nebulizing chamber, you'll have a very fine mist coming out the end of the nebulizer up here on the top. That's how you know it's working properly. Keep an eye on it. I've had hoses fall off of the compressor, just all kinds of crazy things going on. So stick around pretty close so you can keep an eye on what's going on. One thing you need to also remember is make sure the nebulizer is straight. If it's crooked, nothing's going to operate properly. You're not going to get the correct airflow, and it won't use up all the medication. So make sure it's as straight as possible. And make sure it's not leaning in or out. You really have to get that at just the right angle. So that's the only tricky part that I've found so far. The other thing I've noticed is that after the nebulizing process, sometimes the cats will have a little bit of a sticky film to their fur, and the inside of the chamber needs to be wiped out sometimes. And that's fine. Just take a damp paper towel, if you're using a carrier or a storage box, and wipe that out. You need to leave your cat in the nebulizing chamber for a full 30 minutes. Now you may only get 20 minutes or 25 minutes worth of actual nebulizing of the medication. That's fine. If you run out of medication in your nebulizer, just go ahead and turn off the compressor and let the cat sit in the chamber for an additional 10 minutes so that you get a full 30 minutes of treatment. I've read in several places that that is really, really important, to get a full 30 minutes of the medication inhaled into the lungs and into all the sinuses and all that good stuff. And really it takes longer than that, but 30 minutes is fine. And generally you would do this twice a day for a really sick kitty. You can put more medication if you need to, more than 250 milligrams, but they say that 250 is generally all that's necessary. So, and it's the same dosage for kittens or for adults. Weight, age doesn't matter. They all get the same amount because they're actually breathing it in, and the size of the lungs does dictate how much medication they're actually taking into their system. So that's about it. I think it's pretty simple. You don't need any fancy hoses and crazy stuff. It's just this basic nebulizing unit here and your compressor. And you're just going to need to drill a hole in whatever storage box you're using, if that's how you go, so that that will stick into the chamber, and you can put some duct tape around it, something to secure it, or you can just stand there and hold it if you want. But you just need to keep your kitty in there for about 30 minutes, or at least 30 minutes. It can be a few minutes longer. It's not going to hurt anything if it's in there for 32 or 34 minutes. And just keep an eye on things, and you should be fine.